Hello, this FERNE educational video addresses the care of ED patients with dizziness and vertigo with an attempt to successfully diagnose and treat serious central etiologies. This video discusses the head impulse test. My name is Ed Sloan from FERNE, more information to follow. So the head impulse test is the first part of the HINTS exam for patients with vertigo. The head impulse test is only verified to be useful in patients shown to have nystagmus due to their dizziness and vertigo. So we are looking with the head impulse test for asymmetry in the vestibular response to stimulation, in this case turning the head and holding it to 15 degrees and then quickly moving it back to the center. If there's a peripheral etiology to the problem causing the vertigo, there will be a unilateral correcting saccade. In other words, the eyes will have to lag as they move back centrally when the head is moved quickly to the center. In this case, there is a unilateral fast correcting saccade to the center seen with eye movement, suggesting a vestibular problem. A central etiology would be suggested if bilaterally there is no central correction seen to unilateral movement of the head. In other words, if there is no unilateral correcting saccade and the eyes remain centered with both stimulations, then we know it is likely a central problem because no unilateral vestibular problem is demonstrated. If we go to page 12 of the monograph regarding the care of the dizzy patient, this monograph shows how eyes follow rotation to the disease side with a correcting saccade to the center. A unilateral compensatory saccade suggests a peripheral vestibular etiology to the dizziness. If there is no compensatory saccade bilaterally and the eyes remain fixed centrally, which is normal, the vestibular system is working normally on both sides, therefore think a central etiology. This is a graphical representation of that head impulse test. You can see if there is a central etiology here in red, there is no unilateral saccade with head movement to each side. The eyes remain straight forward bilaterally. Neither vestibular system is sick. So if the vestibular systems are normal, think central etiology. Again, the head impulse test is only useful in patients with acute vestibular syndrome in which nystagmus has been demonstrated. Central diagnosis patients, there's no correcting fast saccade. If there is a unilateral eye saccade, that is correct or good when a vestibular etiology is considered for the dizziness. If there's no saccade in either direction, that's worrisome because neither vestibular system appears to be sick. This is the monograph, Timing and Triggers Approach to Patient with Acute Dizziness, published by EB Medicine, written by Jonathan Edlow, a physician with great interest and expertise in the care of dizzy patients. So, in conclusion, central etiology to the head impulse test: no saccade means normal vestibular function. Eyes stay midline bilaterally. No saccade bilaterally, consider a central etiology. If one side has a saccade because one peripheral vestibular system is ill, then you can say it is likely a peripheral etiology. So I, Ed Sloan, am president and board chair of FERNE, ferne.org. Please go to our ferne.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. Follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies. Thank you. If you have comments or questions, get a hold of us at ferne.org, at gmail.com, and have a good day.